Lateral epicondylitis, otherwise known as tennis elbow. This is one of the most common causes of elbow pain and problems, and the pain is usually right out there, but it can be anywhere along the forearm. It's thought to be due to microtrauma from repetitive actions over time at the tendon level, right where it inserts into the outside of the elbow. This causes sharp pain at the bone. It feels like it's the bone, but it's really an issue with the tendon. Injections, medications just cover it up. That does nothing to fix the problem. It's important to note that this starts off as an inflammatory process, but over time, as this goes on, it's a degenerative process. So since it's a degenerative process versus inflammatory, the body needs to build up strength to lay down proper tissue. So the best way to fix this, besides modifying your activities, whether it's repetitive movements with work, whether it's repetitive gripping movements, typing, is to strengthen. You have to find a way to strengthen in pain-free ranges. Even if it's just hard gripping things, like you get that sharp pain like you're talking about. There are ways to strengthen. I don't care if you're using a dumbbell or a band. And if you use a dumbbell, you don't need something heavy. A can of soup, a large can of soup is a good start. So there's a bundle of muscles that attach out here. And one of the muscles thought to be implicated often is the extensor carpi radialis brevis. This muscle extends the wrist, but it also abducts the wrist like this, so towards the thumb. So a good starting point are isometric holds. You don't need a heavy weight, like I said. You just want to hold this for time, 30 seconds, work up to 45, work up to a minute. You can have your forearm resting on a desk. And then eventually you can increase the load. Now this is a 2-pound weight. You can go up to 5 pounds, etc., stronger bands. Another good movement is an eccentric movement. So letting the weight slowly drop as you lengthen those muscles. And if I'm holding this over a desk, for example, you want to do the same thing going down towards your pinky. Slowly letting it fall, and then using your other hand to bring it back up and repeat that process. And eventually you want to work the wrist in all directions. So going up, going down. And this is where a band is helpful. You can go this way against resistance or this way. In addition to strengthening wrist stretching, elbow mobility at the joint, wrist mobility, I show a ton of those things in my wrist list and my elbow list on my profile. Don't get discouraged. This can last a long time and it can be a long process as the body repairs that tissue. We're talking months to years in some cases. Farmers' carries can be a great thing. What that is just holding something to your side and walking, much like you would with a suitcase.